Good afternoon, everyone. We welcome you to the Injury Center's Distinguished Faculty Seminar. My name is Jean Shope. I'm one of the founding directors of the University of Michigan Injury Center, and happy to have you here today. There are refreshments up here, but I'm sorry for you all who are logged in on the webcast. Too bad we can't do that, virtual brownies. Hope I didn't say anything bad. Okay, so today we are debuting a webcast of our seminar for the first time. So we've got people all the way from Georgia, probably at CDC, and on campus listening in. So we're very happy to have them. It would be best if you're online to use a hardwired connection rather than Wi-Fi to keep your signal strong. And Dr. Watson will be sharing a few video clips that are short, but the images may be distorted, but stay tuned. We'll be right back after the videos if you're losing us. We will try to stay right here when we're speaking so that the web people can see us. And there is a place to type in questions, and someone here in the audience will relay your questions to the speaker at the end of the lecture. So thank you for helping us with our first webcast, and do send us feedback if there's something that we could improve for the future. And for those of you here in the room, we will want you to sign in. A sheet will be going around, so we'd appreciate your signing in. And also, please fill out the evaluation form at the end. That really helps us also. And if you're not already a member of the Injury Center, we invite you to join us. It's a very simple application process on the web, www.injurycenter.umich.edu. We do have a few brochures you could see Tina here for if you'd like that information. And a few announcements about Injury Center activities in which you might be interested. We're having lunchtime seminars during the academic year, and a very popular one is coming up on February 6th. Rick Nitzel, professor in environmental health, will be sharing findings from his pilot study on cycling safety, which he actually did in our driving simulator. So come early for that one and be sure to register. Then on February 26th, Professor Tony Abbey from Wayne State University will be giving another distinguished faculty seminar on sexual assault and intentional injury. For students, there will be a call for internship applications coming out soon. These would be funded internships working with a faculty member in the Injury Center. And we have one funded position at the CDC in the Injury Center there. So watch for the announcement. It's a wonderful opportunity. And for faculty, we'll also be looking for placement opportunities for these internships. So we'll be in touch with you about that. And then next fall, there will be an Injury Center Research Symposium. So watch for announcements about that. All right, today we have a very special speaker joining us from Australia, our good colleague, Dr. Barry Watson, who's professor of psychology at the Queensland University of Technology and the director of the Center for Accident Research and Road Safety. Its nickname is CARS-Q, and that's where Ray Bingham and I enjoyed the privilege of being visiting professors a few years back. Dr. Watson has over 25 years' experience in road safety research and policy development. He was with the New South Wales Traffic Authority, with the National Roads and Motorists Association, and with Queensland Transport. And lately he's been involved in development and delivery of courses in road safety and traffic psychology for both undergrads and grads. And he's led research teams examining a whole range of road user behavior, including drunk driving. And in fact, the U.S. National Transportation Safety Board invited him here almost 2 years ago to testify when they became interested in lowering our blood alcohol laws in this country from 0.08 toward 0.05. so his testimony might just have helped them to make that recommendation. He works on speeding, driver licensing, driver education with young drivers, traffic law enforcement, international drivers, etc. I also learned yesterday that he grows his own coffee and roasts it. Now that he didn't expect to learn today. So if you need any tips on that, there's another bit of expertise. So he can, oh, that's right, I haven't, I'm not recommending it. So he studied at the University of New South Wales, the University of Sydney, and Queensland University of Technology, where he did his PhD on unlicensed driving. So today he'll be sharing his expertise with us in road safety in Australia, successes, challenges for the future, and possibilities for the U.S. Please welcome Dr. Barry Watson.
Thanks, Jane. And good afternoon, everyone, both here in the auditorium and on the webcast. It's a real pleasure. I'd like to thank Jean and the Injury Centre for the invitation to come. I've been wanting to come to the University of Michigan here at Ann Arbor for a long while. I didn't realise it was going to be quite as cold as it's been. And for those who may know, in Australia we've been suffering a heat wave. So we've been telling them back in Australia what the weather's like here, and everyone thinks it sounds great because of our heat wave. The other thing I should just mention is I've got a bit of a cold at the moment that I picked up in Washington, so I hope I don't splutter, but if I do a little bit, I might just need to have a drink of water. Okay, so what I'll be covering today, I'll tell you a little bit about our centre and to set the scene about the research we do. I'll then be talking about Australia's road safety performance and comparing that a little bit to other countries, including the US. I'll then be focusing on what's the approach we've taken in Australia, which I think's really led to our success. And in particular, the strong reliance on our traffic law enforcement programs and the use of mass media public education to support that. Also, we've adopted a strategic framework called the Safe Systems Approach, which I think's provided a strong foundation. And also we've set some very ambitious targets for road trauma reduction. But despite some successes, we still have many ongoing challenges, and I'll talk about those. And I think a lot of those will be shared between Australia and the US. And then, as Jean said, I'll talk about some of the possibilities for the US. And I'm not going to be as bold to say that these are lessons I think you need to learn, because context in road safety is very important. You have different legislative requirements, different societal norms. So the things that were done in Australia, I don't think you can directly transpose to the US. But I do think there's some possibilities that you might want to consider based on the success we've had in Australia. Okay, the first thing, well, where in the world is Brisbane? And that's the city I'm from. I know most of you will know where Australia is, down under, but the continent, the country, which is a continent as well, it's about the size of mainland United States. Brisbane, the city I'm from, is in the state of Queensland there. You can see it's the most northeastern state of Australia, so most of the state is subtropical, so it's pretty hot. But although we're a very large country, our population's fairly small. So you can see that Australia's population is only 22.6 million, and the state of Queensland, where I'm from, is only 4.7 million. But you can see from the number of driver's licences, both at a national and state level, that we're a highly motorised country. Okay, well, our research centre, we were established back in 1996. We're a joint initiative of our university and also the Queensland Motor Accident Insurance Commission. Now, they're the government body that regulates compulsory third-party accident insurance in our state. So when you pay your registration to take your car on the road, a bit of it's set aside, and that's used to provide support for people who are injured in crashes. And some of it's also used to fund our centre to do prevention work. We're based in the School of Psychology and Counselling, and we have a strong behavioural focus in our centre, and by background I'm a psychologist, but as I'll show you in a minute, we've got a lot of other people involved in our centre as well. And our vision, and Jean's already reminded me, I've got to stop and not talk too fast, so I'll slow down a little bit. Our vision is for a safer world in which injury-related harm is uncommon and unacceptable. In terms of our expertise, we have about 50 staff and 40 postgraduate research students, both PhD and master's students. And although our original base was in psychology and the social sciences, we've now expanded, and we have really, reflecting the nature of road safety, a multidisciplinary group of people who work with us. We have 3 programs of activities we engage in. Our research program, but I'll come back to that in a minute. We also do a lot of work in terms of supporting professionals working in road safety, in terms of training, both award courses and also more targeted industry-oriented courses. And we also do a lot of community engagement and advocacy. And in particular, we try to provide a lot of advice to government and industry and do a lot of media work and community education work. And part of, I think, our brief is to really not just do the research, but to try to translate it into changes in policies and practice through engaging with the government. In terms of our research, it's grown over time, and now I use these three circles to kind of represent what we do. Our original strength was in road safety and that transport safety area, but we then got involved a bit more in rail safety. So in Australia, we have a lot of railway lines that cross roads at grade. So we have a lot of what we call level crossings. Unfortunately, the safety records of those aren't very good, so we've been doing work in that area. In the occupational safety area, we do a lot of work originally with people who drive for work purposes, but now we're doing work with research on construction safety and other high-risk workers. And in the community safety area, we do work in the school and community injury prevention. So some of that targets road safety, but some of it's just about injury prevention. And more recently, we've also got into product safety. And that includes things like a lot of it's child safety and addressing problems like children's swallowing batteries or magnets or things like that, which unfortunately does occur quite a lot. There's some topics we also look at that are a little bit outside our focus, but do have relevance. And one's eco-driving. So this is driving in an environmentally responsible way. And we're quite interested in that because we're looking at what the benefits might be for safety, but also active transport. So in Australia, there's a big concern about particularly obesity and the need for us to be encouraging more active lifestyles. And of course, that has safety implications. So we are working with people, particularly in our School of Public Health, to encourage a lot more transport, active transport, but that which is safer as well. And our pride and joy in terms of our research infrastructure is our advanced driving simulator. We commissioned this about 3 or 4 years ago. It's actually one of the state-of-the-art simulators, not only in Australia, but in the world. You can see there it's a full vehicle mounted on a motion platform that has 6 degrees of movement with the simulated screen. And that allows us to do a lot of research that either ethically or logistically would be quite difficult out on the open road. And, you know, we're doing studies on driver distraction, aggressive driving. We hope to do a lot more work on marijuana and driving, which I know is quite a topic of interest in the US. Okay, I'd like to now talk a little bit about Australia's road safety performance. Now, this is the long-term trend in Australia's road toll, and the picture it paints is one that's very similar to many other highly motorised countries, including the US. So you can see back in the 1920s a climb in fatalities, then around the time of the Depression, a drop away, then a climb again into the Second World War, then a decline, and then from the end of the Second World War, moving forward, particularly in the 1960s, that period of rapid motorisation, which the US went through too, you can see our fatalities really skyrocketed. We hit the bad days in the mid-1970s when we were up around 3,000, as you see, 3,798 fatalities. But fortunately, around that time, we started adopting a scientific approach to road safety, which was very much modelled on what was happening here in the US. But one of the things Australia's prided itself on is being amongst the first countries in the world to implement a lot of countermeasures. So we were the first to introduce compulsory seatbelt wearing, really the first to introduce random breath testing. Recently, we've introduced random roadside drug testing, widespread use of speed cameras. In the case of graduated driver licensing, which some of you would probably know about, we were among the world leaders, then we fell away a little bit, but we have picked back up in that area now. One concern, though, is that you can see in, say, the last decade that our rate of reduction has slowed. And that's a real challenge that we've got. And I think it's also a challenge that the US and many other countries are facing, that a lot of our big gains we made them in the 70s and 80s, other countries in the 80s and 90s, but our rate of reduction has slowed, and we need to be thinking about what we can do, innovative things to really keep that downward trend occurring. Now, if you look at how we compare to other countries, so this is using one metric, which is the fatality rate per 100,000 head of population. And here there's a collection of OECD countries, so that's the Organisation for Economic Cooperation and Development. These are countries that use a similar definition for fatality, so people who've died as a result of a crash or the injuries are sustained within 30 days. And you can see that and this is one of the more recent times, this 2009 is the most up-to-date period for when the data is available for all those countries. And you can see that in that year, Australia was 16th. Now, we were very disappointed by that. In years gone by, we've been in the top 10 on this particular metric. And as I'll mention a bit later, there is a concern in Australia that we have lost some momentum in this area. So we were around about 6 deaths per 100,000 head of population in 2009. You can see the US, though, in that year was over 10. Now, both in the US and Australia, we often say that this is not always a good indicator for us, that we are both big countries where a lot of travel occurs, and that a better indicator is when we look at fatalities per distance travelled, taking into account exposure. So this is fatalities per 100 million vehicle kilometres travelled. And as you can see, Australia did perform better on this metric. This is an older figure, though, 2008. The US actually isn't here, but I have followed up and looked at the 2010 figure. Now, I know in the US, from around 2009 through to 2011, you've had a very good period in terms of reducing fatalities. And in fact, when I looked at the data for 2010, on this metric, Australia was 0.58, so a little bit lower than we are there, and the US was 0.85. So among the countries there, and performing better than quite a few of the countries, but like Australia, still not performing as good as some of the countries, particularly a country like Sweden and some of the other Nordic countries. Another issue of concern is that, and I've already alluded to this, and what this graph shows is the percentage change in road fatalities in the decade 99 to 2009 across a bunch of countries. And you can see that some countries like France did very well in this 10-year period. And that's partly because previous to this time, they hadn't had a strong road safety record. But when some of you may remember President Chirac, when he was president, he really got behind the road safety issue. And they implemented quite a range of countermeasures, and they performed very well in that 10-year period. Whereas Australia and I think the US performed better back relatively in the 70s and 80s. So both Australia and the US, notwithstanding the fact that I think both countries, if we updated this to 2011, I think we'd be looking better. I think a point that both Australia and the US need to be thinking about is that I don't think we are performing relatively as well in the last decade or so as we have in the past. And I think that there might be a variety of reasons for that, but it's certainly a challenge that we need to face. Okay, coming back to Australia then, a point I've got to make though is that just like yourselves, your Federation of States, we are too, and there's wide variability among our states. So Queensland, the state I'm from, this is the fatality rate for 2013, was 5.82, so that was a little bit above our Australian average, which is on the far right there. But you can see Northern Territory, so for those who've seen movies like Crocodile Dundee, which was kind of set out in the Northern Territory, it's a little bit of our kind of frontier style state or territory. And unfortunately, they have poor roads. There's a stronger culture of alcohol consumption there and a range of other problems. So our road safety performance is certainly not even across our particular jurisdictions. One other thing I'd like to stress, and this also applies to the US too, is that we've made a lot of inroads when you take into account our increasing population and the extra vehicles and drivers on the road. So if you look back in 1954 in our state of Queensland, we had 273 fatalities that year. Our population was about 1.3. So our fatality rate was actually 20.6, which we now equate to a country going through rapid motorisation. By the bad old times of the mid-1970s, we were up to 638 fatalities. Our population had grown a bit, but not a lot. Our fatality rate had even got higher. But the really good news is that if you look at the most recent year, our fatalities are back around 271, so back on a par where they are in the early 1950s. Our population had grown a lot, and our fatality rate had really come down to 5.8. And this is, I think, an issue or story that is often missed, particularly in the media, at least in Australia, and perhaps in the US too, that we've made some great inroads in terms of improving road safety in many parts of the world. Unfortunately, however, though, that's in the highly motorised countries. And later, actually, I'll just go back. Later, I want to come back to the fact that actually now 90% of the world's fatalities, road fatalities, are occurring in the developing world. It's the low and middle income countries that are really suffering the burden now, and they are the countries that are going through rapid motorisation. So a country like China, they've got over 100,000 fatalities every year occurring on their roads, and that's a conservative estimate. So a lot of the lessons that we've learned, they're still implementing, and unfortunately in some of those countries, I think, and of the particular ones that we've been working with are China, Indonesia and India, I think sometimes there's a view that fatalities, road fatalities and injuries are almost like a inevitable collateral damage of economic development. And that's something I think all of us need to be trying to do something about. Another point I need to make too, I've talked a lot about fatalities, and that's only the tip of the iceberg. And this just shows, this data's a little bit older, but you can see for our state of Queensland that the red bars there are fatalities, and because of the scale here, they really look like they're staying the same. But if you look at those other categories of injury, hospitalisation, medical treated, and mine injury, you can see that they're pretty well flat, or if not going up. And this is an ongoing problem we've got, that we've been good at addressing fatalities, but the injury problem is still a major one. And in fact, I was talking to Carol about this earlier, yesterday, we don't even have a good definition for serious injury across our states. So there's a lot of challenges in terms of what we need to do there. Okay, so what I'd like to now talk a little bit about is the approach we've used in Australia to improve road safety. Now, it's interesting, when I talk to people from other countries, and particularly from the US, they often focus on what we've done to really target the behaviour of road users. And whilst I think we've adopted a comprehensive approach, and I'll come back to this later, try and make vehicles safer and roads safer too, undoubtedly what we've really focused on is trying to make road users safer. And in fact, the quote there from Johnson, that's Ian Johnson, a well-known road safety researcher in Australia, he's argued that a key goal of what we were trying to do was to make road users behave more responsibly. And by the way, I think in that quote he was acknowledging it, but also raising the point that we shouldn't solely rely on that. Now, to do this, we've had a really strong reliance on traffic law enforcement programs. So what I mean by that is where you set a rule, a traffic rule, it could be a BAC limit or a speed limit. You then have the police that through various means, and I'll talk about these a bit later, and you have the fines in place for the offenders. Now, in Australia, the other part of the focus here has been also on mass media public education. And in particular, we've adopted two kind of approaches here. And I've referred to them here as reinforcing and transformative. And I've borrowed those terms from the traffic safety culture literature for those who are familiar with it. And what I mean is the kind of public education which is reinforcing is about supporting the purpose of the enforcement activity, telling people why the enforcement's occurring, what's the risks of a particular type of behaviour, and why the enforcement activity is occurring. Whereas transformative is much more about attempting to change cultural attitudes and norms relating to the offending behaviour, to build moral attachment with the law, and to change community behaviour, and both in terms of their attitudes and the follow-on behaviour to it, so that enforcement is not as necessary. Although in the end, I'd still be arguing that enforcement is a vital component. So they're the kind of two approaches, and in a minute I'm going to illustrate those by showing you some of the ads that we use. Okay, so I'd now like to move on. I'm going to present two case studies, one about drink driving and one about speeding. Now, you'll notice I've used the term drink driving. That's what we use in Australia. We don't call it drunk driving. Some of that is only a terminology issue, but part of it I think is that we, as you'll see, have a lower alcohol limit, and I think our thinking about it has been that you can be well impaired before you're drunk. So we've avoided using the term drunk driving. Some of it's only subtle, but I think it also means a lot. Okay, so this is the long-term trend in the percentage of drivers and riders killed in Australia where their alcohol limit was 0.05 or more, so essentially illegal. Now, unfortunately, this data's a little bit old too, and that reflects that, as in many countries, it's hard to get up-to-date national data. But the good news here is you can see that the overall trend is down. Back in the early 1980s, 44% of the drivers and riders killed had a BAC of 0.05 or more. You can see the decline particularly pronounced up until about 2000, and since then a bit of plateauing. And in fact, I do know that if this was updated based on the state-based figures I've seen, that it would be now around probably about 26 or 27%. But what's interesting, that plateauing that's occurred is not only a feature of Australia, but many other countries too. And even it's true of the US. So this is similar data for the US, but it's based on your limit of 0.08. So at first glance, you can see the similar downward trend and then the plateauing. And you might think, oh, there's not a lot of difference between Australia and the US. But if I duck back to the other one, keep in mind, this is 0.08, this is 0.05. And if we presented ours at 0.08, then you could take another 3 to 5% off these figures. Now, to illustrate then how far we're getting down, this is the data for the state of Queensland, my home state. And you can see that this is more up to date, but it's a great snapshot where you can see back in the early 80s, 50% of the drivers and riders killed with had a BAC of 0.05 or more, which I think is a pretty scary thought. But you can see it coming down, a bit of noise in the data, but in recent years being down to around a quarter. So this is a major success story. It doesn't mean that we've solved the problem, but it is a great success story. Now, what I'd like to do now is talk you through how we've gone about addressing drink driving. So we started back in the 1960s and 70s. First of all, we introduced what we call per se drink driving laws, which meant that simply having alcohol in your system was sufficient to be deemed an offence. And this was modelled on the approach the Scandinavians took. Originally, our limit was 0.08. We then, at the same time, started running our first publicity campaigns. Then in the 1980s, we introduced random breath testing. Now, I'm going to come back to this in a minute to explain what it is, but essentially it's a program that allows the police to pull over and breath test drivers and motorcycle riders anywhere at any time, irrespective of how they're behaving. Around in the 1980s too, we also introduced or lowered our limit to 0.05, which I know there's discussion of occurring in the US now. We introduced mandatory penalties. That generally means that if you get caught for drink driving, you will lose your licence. Then in the 1990s, we introduced a zero limit for young novice drivers. We further refined our penalties. One area that we've been behind you in is the use of drink driving rehabilitation, but we're doing that more. And then from about the 2000s, many states now have introduced alcohol ignition interlock programs and also vehicle impoundment for repeat offenders. Now, for those, I know a lot of you will know what an alcohol ignition interlock is, but for those who don't, it's a device that's fitted into the car, typically of an offender, that you need to blow into and register a zero BAC, or there's normally a tolerance or a threshold, before you can start the vehicle. Now, actually, the US and Canada has actually led the way in terms of implementing these. In Australia, we've followed a bit behind, but it's certainly gathering speed now. Now, I'd like to talk a little bit more about random breath testing because it really is the cornerstone of what we do. And it's really an enforcement strategy that's designed not just to catch drink drivers, but really to deter the general population. As I said, the police have the power to pull over and breath test drivers at any time, irrespective of their behaviour. And I know, well, I say unfortunately, there's a reason for why it's the case, but in the US, law enforcement officers can't do that. You've got constitutional constraints that mean that the police have to have probable cause to pull people over. I know you can get around it through sobriety checkpoints, but that's an issue I'd like to come back to a bit later. We also have, if someone refuses to provide a breath sample, they're deemed to have committed a high range offence. The vehicles that we use are highly visible, and it's mainly done in stationary mode. We have the mobile cars that patrol around where the random breath testing is occurring to try to catch the people trying to evade it, and RBT is supported by mass media public education. That's a picture of parked on the side of the road for a police shift, and then they pull the drivers over in, if there's not busy traffic, they can pull everyone over who's passing and breath test them. If it's busy, they'll pull over groups of drivers. Normally they have 6 operators there. They'll breath test them all. Then they'll, once they've done, they'll send them off their way. It only takes about 30 seconds. And then they're on their way, and then they'll pull in another lot. And this is a picture of a car-based RBT operation. So virtually any police car can do RBT as well, but often they're used in conjunction with the stationary operations. Okay, what I'd like to do now is show you two types of ads that are used. One, as I was saying before, about the reinforcing messages versus the transformative ones. So this first ad is an example. I think from memory this is one from Western Australia. And this is and these ads are normally shown often on primetime TV in Australia. And this is an example of one I'd call reinforcing, where it's really designed to highlight to people their perceived risk of getting caught, and really remind them about the enforcement activity. Now, I know the people on the webcast are not going to get a clear vision of this, but hopefully you'll be able to get a sense of it, although I'll be making the slides available later.
Here, Night time, we'll be concentrating on these streets here, here, and here.
Drink and drive, and we'll know.
Good evening, sir. This is a random breath test.
Authorised by the State Government, Perth.
Okay. Now this is an example more of a transformative message. So it's more designed, I think, to influence community values and attitudes.
Simon.
Oh, boys, I'm going to shoot off.
Okay, now I should explain that the term bloody idiot in Australia is a colloquialism for someone who's stupid. It's a little bit derogatory, so when those ads first ran, it was controversial, which I think was their intention. I should add too, I have some concerns about that because we've done some work about the use of high fear appeals, and they, whilst the evidence is mixed, and I think what our research suggests is that they work better, particularly with females. But one group they don't tend to work well with is young males, and they're often the target group. So I wasn't putting that one up as a necessary best practice, but I just wanted to illustrate. Okay, so moving on then. There's been lots of evaluations of random breath testing. We know it's produced long-term reductions in alcohol-related crashes, but the way it's implemented does affect or appear to affect a lot how effective it is. Its best effects are achieved when we do high sustained levels of testing. And it's interesting, many jurisdictions conduct the equivalent of one breath test per licensed driver every year. So we've got about 4 million drivers, they do 4 million breath tests a year. Doesn't mean that everyone will be breath tested in a year, but we've got a 21-year-old son who's often driving out at night. He probably gets breath tested more than I will. But it's a high exposure rate. What's interesting is that there's very strong community support for random breath testing, with surveys showing that 98% approval rating for it. And just to illustrate the exposure to it, this is a results of a long-term WAVE survey or community attitude survey. And you can see this asks people about whether they'd either seen RBT or been tested in the last 6 months. And you can see that in terms of the yellow line there is people reporting they'd seen RBT, and 3/4 of the respondents saying yes, they had seen RBT in the last 6 months, and upwards of, somewhere around 30% saying that they'd actually been tested, really illustrating the high penetration rate of that testing. As I've said, in terms of what appears to be best practice, it's really about making RBT as unpredictable, unavoidable, and ubiquitous. And I think, by the way, a lot of this applies to sobriety checkpoints as well. So it's sustained high levels of testing. The testing needs to be highly visible, threatening, and rigorous. Every driver who's pulled over should be stopped, should be tested. Priority is given to stationary operations to maximise its visibility, but you need the mobile RBT to catch the people trying to evade it. And importantly, police need to be educated about the deterrence principles behind RBT. In the past, I've done reviews of RBT and talked to police, and some of them say, oh, it's a waste of time, you never catch anyone. Unfortunately, they don't really understand sometimes that their role, whilst it's important to catch people, they're really out there to deter the general population from drink driving. Undoubtedly, though, as I showed you, can tell by the data, drink driving is still a problem in Australia. There's major challenges. As I said, the rate of reduction in reducing drink driving is slowed. Recidivist drink driving remains a concern, and I won't go through all the particular data there. And although alcohol ignition interlocks are now implemented in various states, their uptake is relatively low still, which is a problem still in the US as well. The other problem is that alcohol is quite widely available in Australia. And in fact, over the last 20 years, it's probably become more available in terms of the later closing hours, sales, wider variety and where people can buy alcohol, not quite as wide as is the case here though. And we don't use taxation policy much to really address alcohol. So in many ways, I think Australia is an interesting case where random breath testing has been a success, but we're kind of holding the line in some respects against wider alcohol use and misuse in Australian society. And certainly there's a strong concern about increasing binge drinking, particularly among young people. Okay, so that's my first case study. The second case study I'm going to do is speeding, and I'm going to try to whiz through this one a bit more quickly because I can see the clock on the wall and time's getting away. So speeding is our other major big problem. It's estimated to contribute to about 25% of all fatalities across Australia. It's a problem because it not only increases the severity of crashes, which is pretty straightforward, but there's good research suggesting it increases the incidence of crashes. And we know that it's overrepresented. It tends to be more involved in severe crashes, and particularly among certain high-risk road user groups, particularly young drivers, motorcycle riders, unlicensed drivers. Now, over the last 20 years, we've really adopted a holistic approach to addressing speeding by improving the road environment, so addressing speed limits, our enforcement programs, implementing education programs, and increasingly using intelligent transport systems. And I know a lot of that has been happening, and I know there's a test bed for activity occurring here right in Ann Arbor. What I'd like to focus, though, is on our speed enforcement, and we use a variety of ways of enforcing speed in Australia, once again supported by public education. Now, I'm going to whiz through these pretty quick. So the traditional method was traffic patrols, and you can see here's some photos of those, and they tend to be highly visible. We use handheld lasers, which I know used here in the States as well. But we also use a lot of automated enforcement. So we use fixed speed cameras. They're typically at identified hotspots because we know the effects tend to be localised. People slow down when they see the fixed speed camera, but our research suggests within about 500 metres to a kilometre afterwards, they are sped up again. Probably what we've done most innovatively is our mobile speed cameras. So these are in vans that are parked on the side of the road. And in fact, the way we do it in Queensland is that we have a pool of sites that have been identified based on their crash history and complaints to the police. And we randomly deploy our speed cameras to those sites. And as I mentioned a minute, evaluations have shown that to be quite effective. The more innovative approach, though, we're just starting to use in Australia, being used already a fair bit in Europe, and not so much in the States yet, is what we call point-to-point or average speed enforcement. So this is where you have cameras at an entry point. As the driver passes through, a camera takes what you call the license plate, picture of it, and then using optical recognition, makes a note of that vehicle. Then when it leaves down the road, and this could be only a short distance, a mile, or it could be 40 miles, it reads that vehicle again, matches it with the entry time, the distance has already been surveyed, and it can determine what the average speed of the vehicle was. And now we have an average speed offence in Australia. The great thing about this approach is it's really designed to address persistent speeding. So people who are speeding over a longer distance. Now, I'll come on to, actually, I'll come back to it, but we just did a big review of point-to-point enforcement, and we think it shows a lot of promise. Unfortunately, at the moment, there's not a lot of really high-quality evaluations, but the evidence is starting to build, and we certainly think it's something that's worth more widespread use and rigorous evaluation. What I'd like to do now, though, is just to once again show that the kind of style of the public education we do. I'm going to show two speeding messages. The first is, once again, a reinforcing one. This one's from Victoria, and this one is, once again, highlighting aspects of speed enforcement.
If you reckon you can get away with speeding, look at this. Police radars are more sophisticated than ever. He's about a kilometre away, this fella. Watch this. Got him. He had no idea. Here you go. Just slow down, it's not worth it. Over 200 cars with these radars are out day and night. And back in town, the new pro-light lasers can pinpoint a speeding driver in busy traffic and catch him. It's just not worth speeding because we'll catch you before someone gets hurt.
Okay, so that's the reinforcing message. The next one I'd like to show you, though, is an example of the transformative message. Now, I need to just explain something here. I'll use a symbol or an action like this, and it's making an allusion to part of the male anatomy. I think, hopefully, it will be self-explanatory. And this was very controversial at the time. So you can see how that ad was really about some agenda setting, and it was very controversial. I think in some ways it may have built a bit of angst about speeding. Sometimes ads like this can have an unintentional effect too, but certainly in terms of agenda setting, I think it grabbed a lot of attention, and I think got speeding onto the front page of the newspaper, which in of itself, not the be all and end all, but I think certainly served to get people talking about that issue. Okay, now the evidence from our evaluations is looking quite positive. So we've got good evidence emerging now from Queensland about our mobile speed camera program. But at an international level, a Cochrane collaboration review of 35 international studies found evidence for the effectiveness of speed cameras. And as I mentioned, and in fact we've got a paper coming out in Accident Analysis and Prevention very soon about it, I think there's growing evidence about the effectiveness of point-to-point speed enforcement as well. In terms of best practice, what we really are coming to understand in Australia is that we need a program of speed enforcement activity. That fixed enforcement methods, fixed cameras are good, but because of their localised effect, are best at hotspots. But manual and mobile cameras are good in terms of getting a more spread of effect, but we need a mix of different types of operations that really promote general deterrence. But at the moment, we don't, to be honest, I don't think we know exactly what that best mix is, but we also have some evidence that random deployment is good in terms of maintaining unpredictability. Having said all that, at the moment, I don't think we've achieved the success either in terms of the data or in changing community attitudes about speeding that we have in the case of drink driving. We've got constraints. I've already mentioned the fact that particularly the fixed cameras, their effects are localised. Because of the enforcement tolerances we tend to use, which across Australia vary, but in many states are around 10%, our research suggests that just produces a de facto speed limit. So people tend to drive about what they think about 10% above the speed limit because they don't think they're going to get caught. We've also done some work talking about the speed paradox, that some people, even they actually would say to you that, they hold an attitude which is against speeding, but they still report engaging in it. So which really highlights that many things influence behaviour over and above just attitudes, and that there's people actively engage in various strategies to avoid detection. Monitoring reports, so some of our radio stations tell people where the cameras are. There's even things like sharing demerit points, so people taking the blame for other people. Overall, our research suggests that there's a lower perceived legitimacy for speed enforcement compared to, say, something like drink driving. People still think it's more about revenue raising. I think there's a broader cultural support for speeding. So overall, I'd have to say speeding is still more socially acceptable than drink driving, and that exceeding the speed limit, even if it's only by a small amount, still is a more normative behaviour than say, something like drink driving. So there's still a big challenge for what we're going to do. The other thing I should add too is that, we enforce a lot of other behaviours, but we haven't achieved the success with those that we have with something like drink driving. So cell phone use is still a big problem in Australia, even though it's illegal. At least in handheld mode, and for young drivers in any mode, a lot of people still do it. We have very high seatbelt wearing rates, particularly in the front seat, but in rural areas it's not as good, and in the back seat it's not as good. Drug driving, the prevalence appears to be on the rise, although we now have random roadside drug testing, and I could talk about that more later. Our compliance with our novice driver licensing restrictions is probably not as good as it should be. Motorcycle riding's a major issue, unlicensed driving's a major issue, and street racing in particular parts of Australia are an issue. So we've still got some major challenges there. Okay, to finish up, I want to talk about our strategic approach to road safety. Now, Australia first implemented a national road safety strategy back in 1992, and we were one of the first countries to do this. Not the first, I think Britain was the first, but we've had a national framework for how we coordinate all the state's activities since the early 90s. We had another road safety strategy then in 2001 to 2010. It aimed for a 40% reduction in road fatalities. We fell short of that. We only got a 34% reduction, although in the state of Queensland we actually hit the 40%. But a big part of the problem was then that between about mid-1997 and 2002 we had a really static period. And these national strategies, they're promulgated widely, they're published, and the states, although they don't tell the states what to do, they're really there to coordinate and activate the states in what to do. More recently, we've implemented a new national strategy. it's covering the 10-year period 2011 to 2020. A key feature of it is that we've adopted we adopted this back in 2005, the safe system approach. It's modelled, for those who know the background, it's modelled on Sweden's Vision Zero, which argues that we should be aiming for zero road fatalities, or at least have expectations like we would have of any other transport system for our road transport system. And it's also modelled on the Dutch Sustainable Road Safety, which is about better optimising all the elements of the traffic system. It's built on 4 pillars: safe roads, safe vehicles, safe people, and in particular, safe interactions between them. And we have a strong focus on safe speeds as part of that. Now, I can't really do it justice. I can talk about it later if anyone's interested, but the safe system approach really is a philosophy. And it's captured, I think, well in this quote, that it aspires to create a road transport system in which human mistakes do not result in death or serious injury. No person should be killed or seriously injured on Australian roads. So what it's really saying is that inevitably humans make mistakes, and we need to design a system which is in that sense human-proof. If people break the laws, okay, there's consequences, but if they're essentially following the rules, then we need a system which means that you're not going to give your life or be, in effect, accidentally killed. So that's a philosophy. Putting it into practice, of course, is harder. And I should note that as part of this new strategy, we've got a target to reduce fatalities by at least 30% and serious injuries by 30% as well. And I must admit, our research centre and quite a few other groups in Australia were very, very disappointed in that. We wanted a more ambitious target. At least there's a target there. Okay. What I'd like to end with now is some possibilities for the US. Okay, I do think that you can achieve some further reductions in drunk driving based on Australia's experience. I think the first thing to certainly be considering is a lower BAC limit. And as well, perhaps looking at more intensive enforcement. Now, to illustrate this, I just want to really give another quick case study from Queensland. And in fact, I'm going to jump to the slide. In Queensland, we had a series of interventions that we implemented. So you can see back prior to 1982, I've called that pre-0.05 here. That was when our limit was 0.08. We then introduced a 0.05 limit. And you can see there that we had a significant stepwise reduction in, this is alcohol-related fatalities. Then in 1986, we introduced a form of breath testing, which was called reduced impaired driving. At the time, our politicians had reservations about RBT, so it was kind of a soft version of RBT, which is more akin to the sobriety checkpoints you had in the US. But it certainly worked, and we achieved another significant reduction. We then, though, soon after introduced full-blown random breath testing, and we had a further reduction. So this is a case study where I think it shows that by implementing the lower limit, we had an effect, even when we didn't have the more intensive enforcement, but by then improving our enforcement activity, we achieved even further gains. I do think too that over and above drunk driving, I think there's an opportunity by using more intensive enforcement with public education that you can address other behaviours in the US, although I think our experience is less clear in what the actual formula is to do that. And in particular, I'd be arguing that your public education needs to be strongly informed by research, and that I think you need to think about both that reinforcing and transformative approach. And I think particularly the public education is required to not only reinforce the behaviour, but encourage voluntary compliance, build support for your enforcement efforts, challenge some misconceptions. I think a lot of people think that they save a lot of time by speeding when they actually don't. Discourage family and parents and friends from modelling poor behaviour to young drivers or young children who then become their drivers of the future. And I think to encourage the voluntary uptake of new technology like alcohol ignition interlocks. I do think too technology is a big part of our future in terms of road safety. I think you've done a lot in terms of introducing alcohol ignition interlocks in the US, but I think there's more to be done there. I think innovative enforcement activity like the point-to-point enforcement, I think that's something for you to consider. I haven't talked too much about this thing called ISA. That's intelligent speed adaptation. It's like a speed interlock that you fit into the car. And I think there's lots of scope for implementing that with, for example, repeat high-range speeding offenders. In the future, I think we'll have electronic licenses, so you can't start your car unless you've got a valid license. And I think in the end, I don't think we're going to be able to address cell phone use by laws. I think we're going to have a technological solution to it. And I think this is, Jean, my last slide. Lastly, I know a lot of your states have road safety action plans, but I do think that at a federal level, there's a strategic approach is really useful to articulate a guiding vision and kind of promote coherent decision making. It's really about making sure that you don't rely solely on trying to make people safer or vehicles safer or roads safer. It's also good for setting ambitious targets, which really can act as a point of rallying to all those involved in road safety. And I think it's a good way, of course, to highlight priority actions. So my last slide, the thing I'd like to end on is, some of you may have noticed my yellow badge here. That's the symbol for the United Nations Decade of Action. Back in May 2011, there was a proclamation at the United Nations that there would be a decade of action for road safety, commencing in 2011. The aim is to reduce global road fatalities by 50%. I mentioned early on that unfortunately 90% of the world's road fatalities are occurring in the developing world. So a lot of this is about those that have capacity and knowledge in this area, working with those that are building capacity to do something about road safety. So I'd encourage you, if you get an opportunity, not only try to improve road safety in your home, but also if you get a chance to do something in a part of the world where they are going through rapid motorisation and experiencing this problem. So I'll leave it there.
Thank you. Well, that was a wonderful bunch of terrific information and lots of ideas for us to think about. And we have time for questions. I think Dr. Watson's willing to take and even stay later after some of you may have to go. So ask him your questions.
Yes.
I had a question about the random.
Yep.
I was just wondering how that worked and what kind of drugs that
Yep.
it tested for, because I know that,
Okay, so the people on the webcast, this is a question about how we do random roadside drug testing. So we've adopted an approach very much modelled on random breath testing. We use buses so people, highly visible buses, and people do a saliva test. It's an initial screening test, and it's testing for marijuana, ecstasy, amphetamines, and methamphetamines, I think. And to do it, we've adopted per se legislation. So it means that if you've got any of the drug in your system, you're deemed to have committed an offence. Now, I know there's a lot of interest in this in the US, but one of the problems is, whilst the evidence for the crash risks of alcohol are very clear, and for certain drugs, with marijuana, it's still a bit unclear, I must admit. And in fact, I was at a conference just recently where they were showing some data that people are getting mixed results regarding the increase in crash risk associated with marijuana. When it's combined with alcohol, it seems very high. So I think my feeling is, at the moment in the US, there's a feeling that until the evidence base is better and you could specify some kind of limit, that there's probably not going to be taking on a board. It's interesting, in Australia, I think we've just dove in and done it. We may have to refine our approach as we go along.
So the reduction in, how much of the reduction in fatalities is associated with reduction in drink driving? That's one question.
Yeah. So the question is, how much is the overall reduction of fatalities associated with reductions in drink driving? Particularly in the 1980s, it would have been a large part of it, just as in the 1970s, a large part of it was the introduction of compulsory seatbelt wearing. It's a hard question to answer, because against the backdrop of that, you've got continuous improvements in the road environment and also in vehicles. So it's hard to answer it. I think it's hard to partial out what the relative effects are, but I can tell you that the reduction in the introduction of random breath testing, and a study I did and a few other studies I'm aware of, produced about a 20% reduction in alcohol-related fatalities, and alcohol at the time probably represented about 30% of overall fatalities.
So that seems like such a powerful influence. I mean, we're still getting all these fluctuations currently. What kinds of things might be driving that? You know what I mean? In terms of passing away, because that really drove everything down.
Yeah. When you collapse all that, in the end, so the question was about that there's still quite a bit of variability in some of our data. In the end, Australia is smaller and our numbers are smaller. So particularly when you get down to the state level, you know, sometimes we're only talking about a couple of hundred drivers. So I think some of it is just the variability associated with smaller numbers. Some of it I think is to do with particular enforcement campaigns operating in particular years. But once you aggregate the data across the states, some of that noise tends to go. Actually, I think it was over here, yeah.
I'm curious to learn a little bit more about the safe systems approach. Is that all about physical environment?
No, it's not, but it's at its heart. So, the question was about the safe systems approach and the philosophy underpinning it. Its origin is from Vision Zero from New Zealand, which was very much about recognising that there's only certain forces that the body could tolerate, and that really, at speeds of, say, 40 kilometres and above an hour, that unprotected road users are likely to be killed. So a lot of it is about infrastructure and separating vehicles and road users to reduce those kind of conflicts. But I'd argue that safe systems is broader than that, and it's really about, and this is where it has more akin to the Dutch sustainable road safety approach, which is more about optimising the system, using a variety of approaches. So it's not only about improving the road environment, it's about making vehicles safer and also making road users safer, but adopting a more comprehensive approach. So if you tackle the problem of speeding, just don't rely on one part of the puzzle, use it all together. But the real explicit part is that, and some of it is also about where the responsibility lies. Historically, I think, whilst the police have had a strong role and transport departments in Australia to reduce fatalities, I think there's always been this philosophical kind of view that, excuse me, that road users somehow are at fault and that they're to blame sometimes. But the safe systems approach really says that the government has a responsibility to make a system that's safe. And if people are adhering to the road rules, then that they shouldn't be killed or seriously injured. And so it's really about, I think, in the end, does put a lot of the focus back on the providers of the system to design a system that is as forgiving as possible to human error. So there's a bit more to it, but if you are interested, I think it's worth having a read about, because I think philosophically it's very much about trying to position the road transport system where many other systems, like in the workplace, if, you know, for a long while in most workplaces in most countries, as soon as, you know, some kind of injury occurs, there are many things that happen to address that. And there's, you know, no one has an expectation that they should be injured at work. But we kind of live with this expectation now that many people, unfortunately, are killed on the roads each year. So it's trying to shift the focus of the transport system to be akin to these other areas. Okay, yes.
A lot of points you brought up that rely pretty heavily on law enforcement.
Yep.
I had a couple questions about that. Is the proportion of law enforcement officials in Australia and the United States?
Okay, yeah. So this is a question about our focus on traffic law enforcement and the proportion of police relative to the population. No, it's not, but I think there's something that really helps us. In Australia, policing is managed at the state level. It's not at the city level or the county level. So what it means is that the police often have a better critical mass to be able to run traffic law enforcement programs. So in a country town, in the States, I imagine often it's difficult for one policeman to be able to do all the things he's got to do. But in Australia, that policeman will often get support from a neighbouring town or from the main town nearby to run operations, and he'll get support in terms of equipment. The other thing is that it minimises bad practice. So I think, unfortunately, I've known of some cases in the US where I think speed cameras haven't been used in a way that I would suggest is consistent with road safety best practice, and it brings it into disrepute. Whereas in Australia, and although there's still concerns about speed cameras, because it's operated at a state level, there's very consistent policies, and the application of the way it's done is much more consistent. So I think it's not so much our proportion of police. In fact, I'd argue that's probably lower, although it probably varies. It's more that we've been lucky with how our policing is organised, that we've had the ability, and we've devoted a lot of police resources to road safety activities. So I've heard the head of the Victoria Police, so this is one of the biggest police forces in the world because of the way we do things, say that 20% of their budget is allocated to road safety, which is a fair whack.
Bethany has questions perhaps from the web
Okay.
audience.
Yeah, there's a couple online. The first one asks what is the program cost for RBTT and if it's similar to the cost of US sobriety.
Okay, so the question is how does the cost of random breath testing compare to sobriety checkpoints? In of itself, random breath testing shouldn't be any more expensive, I think, than sobriety checkpoints, because the additional cost is that you are actually testing everyone. And in Australia, the way we do that is that it's just the extra mouthpieces that are used on the testing equipment. But having said that, we do a lot of breath testing. So if you even did sobriety checkpoints at the intensity that we do them in Australia, undoubtedly the cost would be higher. And that has implications for policing. So I don't want to fool anyone, but the amount of effort that the police put into conducting random breath testing, and even if it was done in the form of sobriety checkpoints, is very high in Australia. And that's a factor that police need to find that money in their budgets. In Australia, we've been prepared to do that based on the success that we've had.
Was there another question?
Yeah, there was one more. What is Australia doing with regard to skill development in car control and accident avoidance techniques?
Okay. So the question was, what are we doing in terms of skill development and accident avoidance for drivers? This is a very tricky issue. I don't know if there's a short answer to this, because unfortunately our reading of the evidence still is that most of what we'd call the more practical oriented training programs, although they have a lot of face validity, that the evidence base for them is not very good. And in fact, in some cases, there's some evidence that more advanced practical training can be counterproductive in terms of creating overconfidence. There's growing interest in more hazard perception training, and we have a hazard perception test integrated into our driver licensing system. So when, as part of our provisional license requirements, you've got to do an online hazard perception test, but we don't at the moment have any formalised hazard perception training. There's increasing interest in the use of driving simulators to complement conventional learn to drive, but it's very early days there, and the evidence is still unclear about whether they produce safer drivers. And lastly, largely based on the evidence from the US, we don't do much school-based driver education because of the evidence suggesting it could lead to earlier licensing and higher overall involvement in crashes. But having said that, inevitably a lot of schools still engage in activity in this space, so we encourage them to adopt a approach more focusing on attitudes and encouraging safer behaviours across all road user behaviours, not just driving.
Any other questions?
Yeah, I just wondered if in Australia they're not sure about all the other states, but is consideration being given to raising that?
Yeah, so the issue is, well, the question was, have we considered raising our drinking age? So, because our drinking age is 18. It's a great question, and it really highlights that the difficulties sometimes in transposing countermeasures from one country to another and the sociological context. So some of you are probably sitting in the audience thinking that Australia must be a totalitarian place where we have heavy-handed policing, which is not the case. Actually, we tend to be a country that historically hasn't liked too much policing. But we've been prepared to accept random breath testing and compulsory seatbelt wearing, but at the moment there is very little support for increasing the drinking age. There's a strong kind of belief in it, and a lot of this actually goes back to the Vietnam War, when there's a belief that if you're going off to fight for your country at 18, you should be able to drink, and that a couple of years ago, our then Prime Minister floated the idea of increasing our drinking age to 21, and although there's certainly some support in the community, I'd have to say the majority of community thinking was that it was going too far. Having said that, there's some interesting experiences that have occurred in New Zealand with raising and dropping the drinking age. So it's interesting, yeah. Sociologically, we're happy to accept random breath testing, but the issue of increasing the drinking age is off limits. Having said that, though, I think it's probably inevitable that we'll have a zero alcohol limit for all drivers within, I'd say, about 5 to 10 years. So in Australia, we're happy to separate drinking and driving, but I think most people don't want us to stop our drinking.
Like that. Michelle? Industry may be out of the scope of the work that you do, but do Australian children and child passengers fare better?
Yeah, so the question is whether our passengers, particularly children in cars, have a stronger safety record. One of the other areas where we did lead the world was in child restraints. So we've had expensive child restraint requirements for many years. So our son's now 21, and we couldn't bring him home from hospital unless we had him in a baby capsule. There's still been some anomalies we've been addressing. One thing that we've not been very good is stopping kids sitting in the front seats too early, and we are doing some work in that area, but we don't really have a clear requirement. So it's I can't answer the question about how we compare relative to the US. I suspect we've historically done better, but perhaps the US has caught up in that area now, but there's still some challenges. And I think we've still got the big problem for parents is we know that a lot of them have the child restraint in the vehicle, but surveys show that they often aren't fitted properly, and they often aren't appropriate for the age and weight of the child. And getting good advice to parents about that is difficult.
Well, I want to thank Barry again, and just before we give him his final round of applause, there are still refreshments here. Come help yourself for now or later, and turn in your evaluation.
And can I just say, sorry, I should have acknowledged two people. Two people helped me put this presentation together, David Searle and Dr. Judy Flight. I should have acknowledged them from our research centre.
Let's thank Barry one more time. Okay. And feel free to come.